Have you ever felt your heart skip a beat? Or maybe race like a thoroughbred horse? That, my friends, is a heart palpitation. It's a sensation that can be unsettling, even a bit scary, but often it's completely harmless. Heart palpitations are basically your heart's way of saying, hey, something's up. It could be something as simple as that extra cup of coffee you had this morning. That's why we're going to break down everything you need to know about heart palpitations, from what causes them to how they're treated. We'll explore the difference between a harmless flutter and a sign of something more serious. We'll unravel the mysteries of arrhythmias and other conditions that can cause your heart to dance to its own beat. We'll discuss practical steps you can take to manage heart palpitations, from lifestyle tweaks to medical interventions. So let's dive in and demystify the world of heart palpitations together. The truth is, heart palpitations can happen to anyone. Young, old, healthy, or managing a health condition. You might feel it during a stressful meeting, after an intense workout, or even while relaxing at home. While they can be alarming, it's important to remember that most of the time heart palpitations are not life-threatening. By understanding the causes, symptoms, and treatment options for heart palpitations, you can make informed decisions about your health. Imagine a butterfly flapping its wings gently inside your chest. That's one way to describe the sensation of heart palpitations. It's often a feeling of fluttering or quivering, as if your heart skipped a beat or added an extra one. Sometimes it's a rapid pounding, like a drum solo in your chest. This can be alarming, especially if it comes on suddenly. The good news is that these sensations are usually brief. However, if you're experiencing frequent or prolonged palpitations, it's essential to consult a doctor. Heart palpitations can manifest in different ways. Some people describe it as a thumping or pounding sensation, while others experience a rapid fluttering or irregular rhythm. You might notice these sensations during periods of stress, anxiety, or physical exertion. Sometimes certain substances like caffeine, nicotine, or alcohol can also trigger these irregular heartbeats. Do you feel dizzy or lightheaded, short of breath? These could be signs of a more serious underlying condition. While most heart palpitations are harmless, it's crucial to know when to seek medical attention. If you experience chest pain, fainting, severe shortness of breath, or if the palpitations last for an extended period, don't hesitate to call for help. It's also important to see a doctor if you have a history of heart problems or if the palpitations are interfering with your daily life. Early detection and diagnosis are key to managing any underlying conditions. Your doctor can help determine the cause of your heart palpitations and recommend the best course of action. Our daily habits play a significant role in our overall well-being, and that includes our heart health. Stress, that ever-present companion in modern life, is a prime suspect when it comes to heart palpitations. When we're stressed, our bodies release adrenaline, a hormone that can cause our heart to beat faster and harder. But stress isn't the only culprit. Our beloved caffeine, found in coffee, tea, and even chocolate, can also set our hearts racing. So, that extra cup of coffee might be the reason your heart decides to skip a beat. Beyond the hustle and bustle of daily life, certain substances we consume can also interfere with our heart's rhythm. Nicotine, a highly addictive substance found in cigarettes and other tobacco products, is notorious for its negative impact on heart health. It constricts blood vessels, forcing the heart to work harder, and increases the risk of irregular heartbeats. Alcohol, often enjoyed socially, can also disrupt the heart's electrical system, leading to palpitations, especially when consumed in excess. Quitting smoking and moderating alcohol intake are some of the best things you can do for your heart. In some cases, heart palpitations can be a sign of an underlying medical condition. Arrhythmia, a condition characterized by irregular heartbeats, is a common cause of heart palpitations. It occurs when the electrical signals that coordinate your heartbeats don't function properly. Hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormone, can also lead to heart palpitations. Thyroid hormone regulates metabolism, and an overactive thyroid can send your metabolism into overdrive, causing a rapid or irregular heartbeat. Our bodies are intricate systems, and hormones play a crucial role in regulating various functions, including our heartbeat. Fluctuations in hormone levels, often associated with life stages or medical conditions, can sometimes manifest as heart palpitations. During pregnancy, women experience a surge in hormones, particularly progesterone and estrogen, which can cause an increase in heart rate and occasional palpitations. Menopause, another significant life stage for women, is characterized by fluctuating hormone levels, particularly a decrease in estrogen. Experiencing heart palpitations can be unsettling, but remember, knowledge is power. If you're concerned about your heart, don't hesitate to schedule a visit with your doctor. During your appointment, your doctor will likely ask you a series of questions to get a clearer picture of your palpitations. They'll want to know how often you experience them, how long they last, and if they occur at specific times or during certain activities. Be prepared to discuss any other symptoms you might be experiencing, as well as your medical history, lifestyle habits, and any medications or supplements you're taking. This detailed discussion helps your doctor identify potential triggers and determine if further investigation is needed. To gain a deeper understanding of your heart's rhythm, your doctor may recommend an electrocardiogram, commonly known as an ECG. This simple, painless test records the electrical activity of your heart, providing valuable insights into its function. During an ECG, small, sticky electrodes are placed on your chest, arms, and legs. These electrodes detect the electrical signals produced by your heart as it beats, and a machine records these signals as waves on a graph. The ECG results can reveal a wealth of information about your heart's rhythm and rate. In some cases, a standard ECG might not capture the intermittent irregularities that characterize some heart palpitations. If your doctor suspects a more elusive heart rhythm problem, they might recommend a Holter monitor. This portable device records your heart's electrical activity continuously for 24 hours or longer, providing a more comprehensive view of your heart's behavior throughout your daily routine. Wearing a Holter monitor is simple and discreet. You'll be able to go about your normal activities, but you'll keep a diary of your activities and any symptoms you experience while wearing the monitor. This detailed analysis can help identify any abnormal heart rhythms that occur infrequently or only during certain activities. When it comes to managing heart palpitations, sometimes the simplest solutions can make a world of difference. Our bodies are remarkably resilient, and often making healthy lifestyle changes can help restore harmony to our heartbeats. One of the most effective weapons in our arsenal is stress management. Incorporating stress-reducing techniques into our daily routines, such as deep breathing exercises, meditation, or yoga, can work wonders in calming our minds and our hearts. Gradually reducing our caffeine intake or switching to decaffeinated alternatives can help us regain control over those jittery heartbeats. By making these small changes, we can significantly improve our heart health. While lifestyle modifications are often the first line of defense against heart palpitations, sometimes medications are necessary to restore our heart's natural rhythm. Beta blockers, for example, are often prescribed to slow down a racing heart. They work by blocking the effects of adrenaline, that fight or flight hormone that can send our heartbeats soaring during times of stress. Antiarrhythmic drugs, as their name suggests, are designed to correct irregular heartbeats or arrhythmias. These medications work by regulating the electrical signals that control our heart's rhythm, ensuring that each beat follows its proper course. By restoring order to the electrical symphony within our hearts, antiarrhythmics help prevent those erratic flutters and palpitations. In some cases, when lifestyle changes and medications alone aren't enough to manage heart palpitations, more advanced therapies might be recommended. One such procedure is catheter ablation. This minimally invasive procedure involves threading a thin, flexible tube called a catheter through a blood vessel to the heart. Once in place, the catheter delivers energy to a small area of heart tissue that's causing the irregular heartbeat, effectively disabling those faulty electrical signals. Another option is the implantation of a pacemaker or implantable cardioverter defibrillator, also known as an ICD. These small battery-powered devices are implanted under the skin of the chest and help regulate the heartbeat. Living with heart palpitations, even occasional ones, can be a bit like having a mischievous butterfly fluttering around in your chest. But remember, knowledge is power, and by understanding the causes, symptoms, and treatment options, you can take control of your heart health and live a full and active life. Lifestyle modifications such as managing stress, limiting caffeine, and engaging in regular exercise can go a long way in preventing those fluttering heartbeats. Medications, when prescribed, can help restore your heart's natural rhythm and alleviate those uncomfortable sensations. By staying informed, proactive, and engaged in your health journey, you can navigate the world of heart palpitations with confidence. Imagine your heart as a finely tuned instrument, capable of orchestrating the symphony of life within your body. Just like any instrument, it thrives on care and attention, responding best when we make choices that promote its well-being. While we can't always predict or prevent every heart flutter, we can significantly reduce their occurrence by embracing a preventative lifestyle. Think of it as empowering your heart to beat in sync with a healthier, more balanced you. It's about making conscious choices that support your cardiovascular system, from the foods you fuel your body with to the ways you manage stress and prioritize rest. And when it comes to heart palpitations, those small changes can make a world of difference in keeping those irregular rhythms at bay. In today's fast-paced world, stress has become an unwelcome companion for many of us. We juggle demanding schedules, navigate complex relationships, and face a constant barrage of information, all while trying to maintain a semblance of balance. But chronic stress takes a toll on our bodies, and our hearts often bear the brunt of its impact. When we're stressed, our bodies release a surge of hormones, including adrenaline, that prepare us for a fight-or-flight response. This can manifest as a racing heart, increased blood pressure, and yes, even those dreaded heart palpitations. The good news is that we have the power to counteract stress's negative effects by incorporating relaxation techniques into our daily routines. Deep breathing exercises, meditation, and spending time in nature can help calm the nervous system and slow down a racing heart. Nourishing your heart, fueling your body for optimal rhythm. Our hearts rely on a steady supply of nutrients to function at their best. Like a car needs high-quality fuel, our hearts thrive on a diet rich in fruits, vegetables, whole grains, and lean protein. These foods provide the vitamins, minerals, and antioxidants our hearts need to maintain a healthy rhythm. Conversely, a diet high in processed foods and unhealthy fats can contribute to heart disease and high blood pressure. These unhealthy fats and sugars can clog our arteries, making it harder for our hearts to do their job. Think of your plate as a canvas for creating heart-healthy meals. Aim for a rainbow of colors from fruits and vegetables. Choose whole grains and opt for lean protein sources. By making these simple swaps, you'll be nourishing your heart, providing it with the fuel it needs to beat strong and steady. The heart of the matter key takeaways. We've explored heart palpitations from fluttering sensations to underlying causes. Often harmless, they can be managed with lifestyle changes. Remember, your heart is resilient. Make informed choices for its well-being. Healthcare professionals are our allies. They provide guidance and support. Empowering yourself. Taking control of your heart health. Knowledge is power. Understanding heart palpitations helps us make informed health decisions. We become active participants in our health journey. Heart palpitations are common and often benign. The power to influence our heart health lies within us. By making conscious choices, we create an environment where our hearts can thrive. When in doubt, reach out, seeking professional guidance. Seeking professional medical advice is crucial for managing heart palpitations. Your doctor can determine the cause and recommend the best course of action. Don't hesitate to reach out if you experience frequent or persistent symptoms. Your health is your most valuable asset. Seeking guidance ensures a healthier, more vibrant future.